My name's Thaliya Smith, and today I'll be discussing my research question, which is, does vitamin D help reduce symptoms of depression? And during this presentation, I'll just mostly be discussing how low levels of vitamin D is linked to people who struggle with depression. First, I just want to discuss what vitamin D was, and it's a fat-soluble vitamin, which is present in very few foods, and it's also been fortified into certain foods, which means that it's been like added in because it wasn't originally there. Also, the UV rays from the sun are a good source of vitamin D. And I just wanted to provide a few examples of foods that do contain vitamin D. The flesh of fatty fish, such as salmon and tuna, they do contain vitamin D. Also, egg yolks and cheese, they contain little amounts of vitamin D3. And it's been found difficult to find the adequate amount of sun exposure that provides like a good amount of vitamin D that we need. Also, I want to discuss how vitamin D works just as a whole. And vitamin D goes under two hydroxylations in the body for it to work. First, it occurs in the liver and it converts vitamin D to 25 hydroxyvitamin D, aka calcityl. And second, it occurs in the kidneys and forms 1,25 dihydroxyvitamin D, aka calcitrol. And I provided a little image because it kind of explains it as well. And here are just a few benefits of vitamin D. Vitamin C maintains calcium and phosphate concentrations to enable bone mineralization. And this prevents involuntary muscle contractions such as spasms and cramps. And it also prevents bones from becoming brittle and misshaped. Vitamin D also can prevent rickets in children, and with the help of calcium, it also can help prevent osteoporosis in adults. And it's also been linked to reducing inflammation. And the most common way to increase your vitamin D levels, besides eating foods like discussed before, um, are vitamin D supplement pills. And vitamin D supplement pills are like easy to find, whether they're over the counter, like at your vitamin shop or CVS, Walgreens, like pharmacies like that, or even online, places like Amazon. You can order them to your house because they're like safe. And they're also found in common brands such as Nature Made. And next, I'll be discussing the three research articles that I had looked at and discussed. So the first one was just a randomized clinical trial that discussed the effects on vitamin D supplements would have on depression. 56 patients were tested and they were varied in age. It was no specific age. And half the group were assigned to vitamin D supplementations as an intervention, and the other were assigned to placebo. And at the bottom, I mentioned that placebo is a pill or procedure prescribed more for psychological benefits rather than physiological effects. It's more something to reduce people's like anxiety when it comes to like medication and stuff. It doesn't particularly help or make it worse. But the group was shown that their 25 hydroxyvitamin D was increased, and the severity of their depression was decreased. But the placebo group was shown no improvements. Really, it didn't have like much effect. The second article talked about if vitamin D supplements would like have a positive effect for elder patients with depression. And this was a 8-week randomized clinical test where they took 60 elderly patients and they split them into two groups. So the one group with 30 received vitamin D3 pills, and the other group received the placebos. It was found that the group with the vitamin D3 supplements were found to have decrease in their depression score, while the other group did not show much change. And the third one focused on adolescents facing depression and to see if the supplementations would have positive effects. So this was a case series study where 54 adolescents with depression were given D3 supplements over a 3-month period to see the effects, if it would improve, get worse, or like have no effect. And the baseline of their vitamin D levels before the supplementation was 41, and it ended up rising to 91. And they found that their symptoms relating to the depression were improved. And overall, they found increase in their well-being. So I feel like that just like showed the effect that the low levels of vitamin D were like somewhat worsening the depression, because when they improved, like they overall felt better. And then in conclusion, I said that depression, as we know, is a serious mental health issue that many struggle with, and vitamin D is not a cure. Although they're like finding that continuation of research, they're finding more effective treatments. And I said the links between low vitamin D and depression are a step in the right direction, because I feel like as a whole, if this is something that will help people dealing with this mental illness, that this is something that could be effective and should definitely continue to be looked at.